terms of that today, do you have any advice for students looking to become PhDs? Is there anything that you would suggest as either from a hard skill perspective, or do you see that there's a need now to make sure that as a PhD candidate that you think of yourself a little bit more interdisciplinary than maybe in the past?
Well, there are two things. On the one hand, I think it's always good to try to work in labs as soon as possible. That's also something you, for example, even
if you don't know exactly what you want to do, just work somewhere in the lab.
Start early. Of course, it should be something that's of interest to you. I didn't do this. Yeah. But
this is looking back on it.
Yeah. But I think it's good. And also, for example, if you look at first-rate Max Planck directors and researchers, they started very early in their career, no matter what they study, medicine or whatever, physics or whatever, working in labs. I think that helps you. That's one thing. People get to know you, and if you're good, if you're interested and whatever, that's one thing. The other thing is when you study, I think it's important to not only focus on one thing in order to get a good grade or whatever, but try if possible to get a broad training, because ultimately this will pay off.
And I think what's also really fascinating is that you, which I think is kind of the future, you took a computational approach to everything, right? So it allows you to kind of lay out where maybe the best opportunities are and then go test those in the lab, as opposed to kind of the old school way, which was test everything and hope that you find one. So you can almost get there a lot quicker. If you can figure out the computational component, it kind of gives you a directional, at least, action.
Yeah, exactly. And we were guided by qualitative predictions. It's also something some biologists weren't used to, so to speak, because qualitative predictions mean you have a mathematical model, and of course it's way too simple compared to reality, but it can be complex enough to guide you and provide you with the right study protocols, experimental protocols, make the right predictions. For example, when you have a non-trivial phenomenon, it tells you this can happen. Of course, then you have to come up with a right protocol, and you have to think about what could be a possible time scale on which this evolves. But it will not tell you how many minutes, seconds, hours you have to wait.
And do you think that's really helped you to have like that physics background, bringing it into neurology?
Yeah. Oh, yeah.
And that was pretty unique back in the day too, right? Because physics, in terms of a neurological system, was never usually applied.
Yeah. But you see, my point also from the very beginning was, I think it's really important to bring physics into medicine, not as a means for example, for generating devices, X-rays or whatever, X-ray devices or whatever, but also as a way of thinking. The way that chemistry came into medicine and produced all of the benefits, something like that should also happen with physics in terms of system theory. I think if we better understand the interactions of the different organs, different cells, and all the entire complexity, we'll be able to come up with milder and more effective treatments.
That makes a lot of sense. Because then you're actually understanding the interaction of the system itself as opposed to, and thinking of it, I think more, because again, a chemical reaction tends to go very linear, right? But a physics system can actually have multiple planes in a sense.
Yeah.
That makes a lot of sense. I guess, coming to kind of modern day, you've actually kind of almost pretty close, it seems like, to achieving your vision of bringing a product to the market to help. What's that felt like to, again, I think I read part of your book, it was from like 1999, where you kind of first outlay the first kind of principles of it. And, you think about it from 1999 till now is it takes a lot to get there. So, what was that feeling like when you can almost see the horizon line coming there? It's
a deep satisfaction. And seeing things working in patients is way more satisfying than any paper test you version.
And did you see it's just the like you said, it's just the start, right?
It's the start. I think it's really the start. And then, because that's also the good thing, you see, we can measure what we're doing. So it's not just we have theoretical prediction, and then we try something, and if it works, fine. If it doesn't work, okay, we have to go back to theory. But we can really measure what's going on in the brain. For example, means of EEG, electroencephalography, and also other things we can measure. For example, also in a very beautiful way, wave propagation of vibratory waves in the skin when we do vibratory stimulation and all this. And all this has to be put together. And I think the better we can come up with the synthesis of these different parts and aspects, the quicker we can optimize these treatments.
And what do you have to do to stick? I think that's exactly right. Like the labs, they kind of operate in their own, you can, in a computational sense, you could always, X out the error terms, right? How does that work in terms of, did you have to do like multiple studies to start getting that in there?
I think in some sense, ultimately it boils down to the quality of people you are able to work with.
Good.
Because it's not just about one person, you see. There are different fields, different aspects, and people should really be good. Because otherwise you can do whatever you want, and it might be very difficult.
Right, and finding even outside partners to bring it to market, right? Just even that process has to be totally different. Because
that is grand difference. Yeah.
Is there any advice to students about that whole process that you would give in terms of thinking through it?
Yeah, that's a good point. It's a very good point. I think what makes sense is also when you have this fantastic network, what you could try, for example, just a suggestion, is to go to companies like Verily or others, Verily or the likes.
Oh, is it the Google?
Yeah, and recruit also mentors from there.
Yeah.
People who have done, for example, math development and approval processes many times. And I think this is something students could really learn from very much.
Can you talk, since you mentioned partners as being crucial, can you talk about the advice you would suggest for candidates to find, how do they find partners, or any characteristics to look for? Is it matching personality? Is it different personality? Is it, how would you kind of suggest figuring out the right partner for yourself?
No, on the one hand, I mean, the department has set up a certain structure of support, and this works very well. So it's not a question of selection. Fortunately, it is very positive. But I think in general, when you're in an early stage of your career, I think it's really important to make experience, even if it's not the best experience at the beginning. But it's important, I think, to understand what a certain field of research is, not only in terms of textbooks or papers, but in terms of actual work. And different, at least in my experience, I mean, different people working in different fields also have different average attitudes. And you should know what you like, who you are, who you would like to become, and whether you are really happy staying in particular environments. For example, physicists, just in first approximation, physicists are super nice guys.
Is there one thing that you would recommend for a student considering becoming a PhD candidate? Is there anything that you would recommend that they do while in school, or anything else that, looking back, that you would change in your own kind of start of education?
And not that I would change it, but I think there are two things. On one hand, it should be a combination of what I was driven by in some sense was always the combination between really hard work in terms of broad training, but passion, real passion, satisfaction, because then the hard work
doesn't feel
painful. You see? Otherwise, if it's just painful years of work, I don't know that I would do this.
Kind of, where do you see kind of the future going? Because I think what's been interesting to see your papers and how they've expanded, I saw some for tinnitus, focus on that. But then also I thought was really interesting was even for alcohol dependency. There was one, even for that. So I was wondering, is that where you see the future of not only, it can even be for like when you feel a little bit low, to create a simulation that kind of shocks you out of that state.
Yeah, might well be the case. I think we're just at the beginning. And what I think is if we design, if we use what you can use based on math, physics, but also machine learning, also IT, and with the appropriate experimental measurements, I think we can come up with stimulation techniques that can help us a lot, really a lot. And in some sense, we are just at the beginning, in a very early stage to some extent. And if you think, for example, just as an example, what you can get, what kind of data you can get with an Apple Watch or other types of watches and smartphones, and use this in order to tune on a longer time scale, in order to adapt in a personalized way to a specific patient